Hi, this is Dr. Bob Dannenhoffer, Public Health Officer for Douglas County here in Oregon. It is December the 4th, and we'll go with our regular Tuesday, Friday Facebook Live. This is a chance for me to give you some statistics, but then for people to ask questions. We already have a couple of really good questions in our Facebook questions section, so you can send Facebook questions at douglaspublichealthnetwork.org, and we'll get those and go through those. Do those first, and then we'll do the live questions that come in later. But as always, we start with the world view and then come down to Oregon to see what's happening. I'm here alone, so I'm going to take down my mask. This is a mask, buy these in the store about $1.50. Pretty nice. So in the world, 66 million cases, 1.5 million deaths. A lot of deaths. The case rate is now beginning to flatten because the number of cases in Europe is decreasing. And except for the U.S., there's no other place that's really increasing quickly. But, we're still having many, many cases a day, over 10,000 deaths a day. That's stunning. The leading places in the world where it's busy is U.S., India, Brazil, Russia, France, Spain, U.K., and Italy. When you look, the U.S. is still going up, Brazil's going up, Russia's going up, but India, France, Spain, U.K., and Italy are all going down. And when you take the number of cases in the U.S., the cases in all of those other countries combined, India, Brazil, Russia, France, Spain, UK, and Italy, about 2 billion people, is less than just the U.S. total. So the U.S. is still way out of control. Much of Europe is now getting this into control. And indeed, in the U.S., the numbers are really quite grim. 14.5 million cases, 282,000 deaths. Yesterday, there were 216,000 cases and 2,900 deaths. 2,900 deaths is more than two deaths a minute. Over 200,000 cases we thought we would never get to, and now we've gotten over it several times. 39 states have more than 1,000 cases, and we have the highest death rate ever. So this number of deaths is higher than in that beginning awful surge, bigger than in that middle surge where there were a lot of cases, a lot of places out of control, and we're now higher than that. If you look at the entire country, only northern Maine and Hawaii are really under control. Oregon is close, but almost every other place is miserable. Now, you'll remember over the last week or so, I said you really have to be careful about the numbers and the deaths because there's a lot of late reporting around holidays. And when you look at the case rates and when you look at the death rates, there's a lot of static in those because there are a lot of health departments that don't work on over the 4 days of the holidays, and then they have a lot of cases that come in later. We worked every day, so we didn't have quite that up and down. But hospitalizations is the one thing was really quite smooth. We're now over 100,000 hospitalizations in the U.S. That is really scary. In Oregon, the cases were flattening, so we'd been at the 1,600 for a few days. We are starting to flat down a little bit now, but the deaths are up. And this is the highest weekly death count that we've seen in a while. And hospitalizations, again, a really smooth curve at an all-time high. Now over 600 hospitalizations. Now, in all of Oregon, that's not that much. We've got a lot of hospital beds, but we don't have a lot of extra hospital beds. And some of the hospital beds are still required. Moms are having babies. People are having heart attacks. People have cancer that they need to get treated. People get their appendix out. So all of those things are still happening. And now we're adding an additional 600 people with COVID. And that is really, really stressing some of the hospitals, especially in Portland. Douglas County, we've done a little bit better, but still really grim. We're over 1,000 cases now. We had 3 deaths today, and I believe there's going to be another one reported tomorrow. So a lot of deaths. Remember, gatherings like we had around Halloween and Election Day, followed a few weeks later by cases, followed a few weeks later by hospitalizations, followed a few weeks later by deaths. So these deaths we're seeing now are related to activities mostly in the first week of November. And so this is not shocking. When we look here, they're again related to gatherings, parties. They're related to, we have 2 large nursing home outbreaks. And we're starting to see a bunch of cases related to Thanksgiving gatherings. So this will come as no surprise to anybody who's listening to me. People get together from all around the state in different states for Thanksgiving. Everybody seems well on Thanksgiving, but the next day, one of the people who attends Thanksgiving says, "Oh, I'm sick," and they test and they're positive. They call everybody who was there, and then those people now need to quarantine for 2 weeks. So there are at least 4 of those situations we know about, and likely many more, and that really is a big problem. All right, let's go through some questions and we'll see what we get. So the first question is, it is a Facebook posting from a thing called Health and Money News. Never heard of it before. And it says, the head of Pfizer research, COVID vaccine is female sterilization. And it suggests that the previous head of Pfizer research is a fellow that petitioned the EU to change the way they do things, and they take that he's worried that this is going to cause sterilization. So, when on these things, I never just sort of look at the newspaper. I actually went to his complaint with the European Union. And his complaint with the European Union was a very technical complaint about the cycle threshold they were using for testing the Pfizer vaccine. As you may know, the PCR test has this cycle threshold. So it takes the RNA that it finds and it multiplies it. And the more times it has to multiply it for you to find it suggests that the original amount was lower. If it only takes a few cycles to find it, suggests that the virus amount was higher. And so his complaint with the European Union was about the cycle threshold that they were going to use in the vaccine trials. It had nothing to do with this female sterilization thing. What best I can tell about this is that there is a protein on placentas called syncytin 1, which we've known about for years. The placenta is the mass of blood vessels which the the cord attaches to, and that's how you get nutrients and oxygen and waste products back from the baby to the mom. And so we've known about this for a long time, and there are lots of proteins involved in there that allow this to happen. There are lots of spike proteins, but this sort of conflates the spike protein from this virus with the proteins that are on the placenta. As best I can tell, they have nothing to do with each other. And when I looked them up, they look totally different. So this looks like, I don't know where in the world they come up with the infertility, except for this report and reports of this report. I can't find it anywhere else. So I don't have all of the data at me, but this looks like one of those hoax things that looks very professionally done. It's the head of Pfizer research, so you think, oh, he must know what he's talking about. COVID vaccine is female sterilization. Wow, this sounds like terrible. I wouldn't want this if I was going to get sterilized. But there doesn't seem to be anything to suggest that this is true. All right, so this is a family where everybody's had COVID, and then the question is, since we've had COVID, are we sort of like free to go and travel and whatever else? Well, we think that in the 90 days after infection, you are very unlikely to get reinfected for the first 90 days. After that, all bets are off. But for the first 90 days, we think you're probably a bit less likely to get it. And so that, would your risk be lower after having had it? Yeah, I think your risk would be lower. Is it zero? No, but it would likely be lower. So this next question is, what treatments and vaccines are being used in Russia, China, India, and other countries? So very complicated because there's lots of different vaccines. So Russia, China, India all have different vaccines. They've all chosen different types of vaccines. So India, a very large, not particularly wealthy country, has chosen to have a vaccine that is made like our hepatitis B vaccine, where you get a gene that can make the spike protein, you put it in yeast, you have the yeast make a lot of the spike protein, you then inject the spike protein in people, and they get an antibody response. It's kind of how we do lots of other vaccines. It's a tried and true approach. There's not yet out yet, but I think it's likely to be successful. China has 3 or 4 different kinds, including an adenoviral vaccine and an RNA vaccine. I don't know exactly where it is. The Russian vaccine is already out. They said they're going to do it. But the details on it, exactly what it is and how it works, we don't really know. In terms of therapeutics, I think everybody in the world is using about the same thing. The Chinese are using some herbal medications. There's some place in the world that are still using hydroxychloroquine. I'm and I'm sure that helps very much. But for the most part, what we do know is the things that do work is Decadron clearly works. Remdesivir may work a little bit. As an early treatment, the monoclonal antibodies may work a little bit. Plasma, which we heard a lot about 3 or 4 months ago, that is, you take somebody who had the disease, take their blood, give it to somebody else. We thought it was going to be great. It's been pretty disappointing. It has not been particularly effective. Hydroxychloroquine doesn't seem to work. There's this funny one report about Luvox, which is a drug used to treat obsessive compulsive disorder, that does actually, in the one study, seem to be effective, and we're waiting for more studies. So somebody talks about disinfecting groceries. If we don't need to worry about getting the virus through our groceries, why are other surfaces different? And so groceries, if you think about the way groceries work, there's celery there, you pick it up and you put it in your cart. For you to actually get the virus there, you would need to have somebody cough on the celery, then you pick it up at the same place, then you touch your face and get it. So we think the chance of that is pretty low. The surfaces that we do worry about are things like door handles. So if you can imagine a door handle at a store that doesn't have automatic door handles, there might be hundreds of people who would touch that. And so there could be viruses on that. So those are the kind of surfaces that we worry the most about. But groceries, walls, ceilings, not so much. So there's a person who has a complicated quarantine isolation question. And so what I would encourage you to do is send us a private message and we'll get back to you privately. The concern is for me to explain this online is going to be confusing for everyone. So someone says, since the COVID vaccine will be available to the general public in the springtime, what happens when next fall comes around? Most people get the flu shot to get them through fall, winter, spring. So if the COVID vaccine is spring, when will people get the next vaccine shot for the next year? How long does the vaccine protect you? Is a yearly vaccine like the flu? We do not know the answer to that. What we do know, since the first people to get this got this in September, we do know that for at least 90 days after September, you have high levels of protection and high levels of antibodies. What they're going to do is they're going to follow these people who got vaccinated in September, monitor their antibody levels, and look to see if they get disease. If they start to see them getting disease or the antibodies decreasing, there may be a booster. Although, maybe not. It may be that the vaccine is good enough to have a high enough level of antibodies that you don't need a booster later on. Now, the flu vaccine is not a particularly good vaccine. And since it's not a particularly good vaccine, you only get about 50% protection and it only lasts for a while, and that's why you have to get it each year. This one, much better protection. So Bruce says, I see there's an mRNA-based rabies vaccine. Actually, there are 4 mRNA-based vaccines, none of which are in widespread use. So the rabies vaccine is in early use. It was tried in like 100 people, 300 doses total. And it looked like it was probably safe and effective, but hasn't gone further than that. There were 2 for the flu and 1 for cytomegalovirus, all of which looked like it was pretty safe and could be effective. But all of these were really tiny studies, just a few hundred people total. So I don't think we can learn much about long-term risk for the vaccine. Now the good news is we haven't seen it. So some of these are back as much as 5 years ago where people got, for example, the mRNA rabies-based vaccine, and in that time they haven't developed any new problems. That's a good sign that there's not going to be anything else. But with only 100 or 200 people, it's really not enough people to know. You really needed 10,000 people, and that's why they required 10,000 people in these studies. At 10,000 people, you'll find almost all of the big problems. You may not find things that would develop later, but those are pretty rare. You may not find things that were really rare, but that was reassuring that these trials here have not found side effects with the Moderna or the Pfizer vaccine, and that there are no long-term side effects, seemingly, with those few hundred people who got those mRNA trial vaccines back 4 or 5 years ago. Okay, let me see, we have new questions here. All right. So if someone has recovered from COVID, well, they need to get the vaccine. So if you've had COVID in the last 90 days, you are not a candidate for the vaccine. If you had COVID more than 90 days ago, you are a candidate. So Kathy says, have we had another outbreak or are we seeing community spread? Well, both. So we are starting to see just community spread where we can't exactly figure out where people get it from. Although almost all of our cases, we can find a likely cause. Now, unfortunately, with the disease, like all diseases, you don't get a receipt. So you can't be sure. But the incubation period on this is predictable enough at 5 or 6 days that we can usually figure it out and we can usually tie it to another outbreak. So about 70% of the time over the last few months, we've been able to do that. But there are a bunch of outbreaks. These outbreaks have been related, as I said, to 4 different four different things. There's a big outbreak down in Forest Glen. There's a big outbreak at Curry Manor. And then there are a bunch of smaller outbreaks around at the hospitals and multiple workplaces and whatever else. When there's this much disease in the community, any big employer is going to get a bunch of cases. Although I will tell you that we've got most of the outbreaks under pretty good control now. We're just sort of waiting to see if there are going to be some big Thanksgiving outbreaks. Common thing I'm hearing from people is that when a positive test is given, regardless if it's the same person that's been tested before, you listed the guys as another case. That is not true. So Thaddeus, you've asked this question before. So the story is we consider the cases by people. So the only time you could be a case more than once would be if it was more than 90 days in between. So if it was more than 90 days in between, probably is a second case, but we're doing it by person. So if you get a test and then another positive test, it's still just one person who's got the disease. I also heard that the White House told public health officials to tell people how bad it is and to be blunt. Did you guys get that memo? Well, it's so hard to know with the White House. We've gotten so much confusing stuff from the feds, where multiple different people talking or whatever. The stuff we get from the CDC and Oregon Health Authority has been incredibly consistent that this is bad. 100,000 people in the hospital is really bad. 2,800 deaths a day is really bad. Hospitals needing to cancel elective surgeries because of so many cases is really bad. So it's really bad. 20 some odd people died already in this county. All deaths are tragic. 20 deaths is a lot of deaths. And when I look at the deaths, many of these people have birthdays after mine. So these are not all old people who are about to die in the next week anyway. So many of the people, at least in our county, have been people who have been out and out at gatherings, and that's how they get it. They're well enough to be out at gatherings. Now, we have had some outbreaks in nursing homes, and these are people who are older and sicker, but still it's lives. They still had families and grandkids and whatever else that they wanted to visit. So Desiree says, I've heard people complaining that an mRNA virus will change our DNA. Is there any truth to this? Well, of course, nobody can tell you 100% about everything, but the way messenger RNA works, and messenger RNA has been around since the beginning of time. So messenger RNA are small snippets of our RNA that carry the directions for making a protein. So the DNA is, as I've said before, if you think of the DNA as being like the book of encyclopedias, where you have two copies or 2 of each of the 23 chromosomal pairs. Now, each of them may be different, but you have 2 copies of book 1, 2 copies of book 2, 2 copies of book 3, all the way down to 46, which has an X and a Y. That's what the DNA is. The RNA is a bunch of different RNAs, but messenger RNA is like the scratch pad where you write down what the formula for the protein is, and that's what it is. We do not think that messenger RNA can change DNA. So there's no sense that this is going to happen. But since messenger RNA vaccines are relatively new, people are going to be worried, but I'm not worried about that. Is there something that someone in their 60s can safely do that doesn't involve the outdoors? Something low risk that you can do while wearing a mask and socially distancing? Well, you can certainly do things by yourself. Doing things with others is more risky. doing things with others indoors is riskier still. So you can do things. But it's hard. I mean, it is hard because people in their 60s and above, if they get the disease, can get really quite sick from this. So Melinda says, I don't understand the difference between quarantine and isolation. So isolation means you have the disease and you should stay away from others so you don't give it to them. Quarantine means you've been exposed to the disease but don't have it and could develop it and should stay away from other people so that if you get it, you won't give it to them. There's not a huge difference between it other than public health uses them differently. It turns out that this week there's a change in the quarantine requirements. So previously it was if you got exposed to somebody else with the disease, you had to quarantine for 14 days. We've been following that because we follow the rules, but we've looked at it and said, well, the risk of developing this in the 12th, 13th, and 14th day is very low. It's just a few percent out of the 100. Almost everybody's going to develop symptoms is the 3rd to 8th day. So, those 12th, 13th, 14th days, people get itchy at being at home, they're losing wages, and they don't have a really high risk of getting it. So we suggested that you might be able to shorten the quarantine, especially if you did testing, and the CDC has this week said they're going to do that. So now, if you are a contact of a case, you should quarantine you have 3 options. One is to just wait 14 days. That is the safest, but also the longest. You can quarantine at 10 days. The 11th, 12th, 13th, 14th days, go back to work and monitor for symptoms. Or you can get tested on the 5th, 6th, or 7th day. And if that test is negative, stop quarantine after the 7th day. So now you have 3 options for quarantine. I think this is great because that second week in quarantine is really hard for people and their risk is low. Now, this does slightly increase the risk that people who are contacts are going to give it to others. So if you wait the full 14 days, your risk of giving it to somebody else is less than 1%. If you do the 10 days, it's 3 or 4%. If you do the 7 days with a test, it's 4 or 5%. So it's not a huge increase, but it's still not quite as safe as working the 14 days. But for many people, it'll be much, much easier to do. So is it necessary for all small and non-corporate business to be shut down? No, it really, really, really isn't. So business, it's not important that businesses close down. I mean, I think the stores that are open using masking and the way they're doing supermarkets and whatever else, it's perfectly fine. We have not seen a lot of spread in those areas. The places where we have seen spread is where people gather, and especially gather and take down their masks. So unfortunately with restaurants, if you didn't eat at restaurants, if restaurants were about something else, restaurants would probably be okay. But the problem with restaurants is you take down your mask because you're eating and you're tending to be there and you're tending to laugh and do the other things. So that's why we've seen spread at these gatherings. And these gatherings have occurred at restaurants, they've occurred at churches, they've occurred in workplaces. And it's typically that. It's typically people around people they know, they take down their mask and then they share whatever they're sharing plus their germs. So I don't think it's necessary to shut them down. I think where we're at now is probably okay. The hope would be to get our case rate down. If we were able to get our case rate down, we'd easily be able to open more things. I know restaurants and bars are really, really hurting with this, especially restaurants and bars that have a hard time with takeout, and they are really hurting. And we, as a society, really need to help them. So Annabelle says, do you think this generosity that funded the research will yield advances in other fields of disease research? And I think absolutely. So I think if this mRNA vaccine really works as well, we may well be able to really change vaccine technology by using more of these mRNA things. And it's not beyond belief that we could get a vaccine for malaria, we could get a vaccine for AIDS, we get a much better vaccine for influenza, we might get a vaccine for tuberculosis. So I'm really excited about the changes that we've made in vaccine technology. We've also made a lot of advances in our understanding about how disease spreads. sadly, we've not made a lot of advances in the treatment of this disease. The things we're using, remdesivir and Decadron, hydroxychloroquine, all those things are really quite old. Missy says, will it be mandatory for those in the healthcare field to get the vaccine? I can't predict the future, but I think it's so incredibly unlikely. This is going to be an experimental vaccine. I really don't think we can force anybody to take an experimental vaccine. And so I cannot believe this is going to be, I can't believe this is going to become mandatory. And then a follow-up question on this, Katie says, is the vaccine going to be required for kids to attend school? No. Right now, the vaccine isn't even approved for kids, so obviously not. But I don't think it's going to be a required vaccine for school. So what vaccine are you thinking of taking? Dr. Fauci said there are like 5 out there being tested. Yeah, there's like 140 different vaccines in the world that are out there. The 2 that we're likely to get here are the Pfizer and the Moderna vaccine. I'll take whichever one is available. The Pfizer vaccine requires super ultra cold storage. So it's likely to only go to big areas like hospitals that have the capacity and backup generators and whatever else to store the super cold vaccine. For people outside the hospital, they're probably going to wind up with the Moderna vaccine, which can be kept in the refrigerator for 30 days. I saw today that Oregon looks like it's going to get over 100,000 doses by the end of the year. So that's great. So Tracy says, if somebody has had COVID, can they later be an asymptomatic carrier? So we do know that if you have had COVID before, you can get infected the second time and be asymptomatic. So I don't know if that's exactly what you mean by a carrier, but yes, the very first case of somebody, which was well documented, somebody got it second time, was a traveler. I think they were from Hong Kong. They got it the first time when they were sick. They came back from Spain. They had a second infection, and they were asymptomatic. So yes, you could have gotten it before, then get it again and be asymptomatic. Whether you're able to spread it, we don't know. So is remdesivir being used as a treatment in this county? Sure. We've already had a bunch of people treated with remdesivir. Again, remdesivir is not magic. It does seem to shorten your ICU course and maybe shorten your hospital stay, but probably has little difference. In mortality. So Joanne says, should I be worried about seeing my hairdresser? She's alone in the shop, first appointment of the day. We'll both wear masks. I have an appointment next week. The good news is this was an area we really worried about, right? Because barber shops and beauty salons, we thought there might be a lot of spread. We have looked. We have not been able to find any, and very few people have been able to find any. In fact, there's one well-documented case where the 2 workers were positive. They wore masks. Everybody else wore masks. None of the customers got it. So I'm not saying that it's the least risky thing to do, but it seems to be relatively low risk. But wear a well-fitting mask. Be sure the person who's cutting your hair uses a well-fitting mask. Don't spend too much time chatting and doing the other things that people seem to like to do at the hairdresser, and you should be good. I'm scheduled for cataract surgery on the 9th, Catherine says. It's an eye clinic and not a hospital. Is this risky? Never occurred to me that they'd schedule it if it were risky. Well, again, remember on risky, there's no bright line. It goes from very low risk to very high risk. I would think cataract surgery and eye clinic would be relatively low risk. People should be in the OR, should be wearing masks. Presumably you're going to do this under a local anesthetic or sedation, so you might be wearing a mask. So this is not a high risk. So Lane says, what's the turnaround on tests now? And Christian, you may get us what our turnaround time today was, but it depends on which test you're talking about. The test we are recommending for symptomatic people is the Binax or the Sofia Kydell. They have turnaround time of less than an hour. They can be done in the office. They can be done in less than an hour. So I had a long conversation today with our regional testing coordinator, and she said, she's a regional testing coordinator, and she said, I really don't think we have a good, clear statement on what we should be doing with testing. So we worked for an hour, so we came up with this statement. So in the COVID-19 pandemic, testing is critical because without testing, we are flying blind. Our first and highest priority should be readily available, accurate, and rapid tests for Binax that are as easy and cheap to get as a lottery ticket. So that's the first thing. And so really, if you're sick with any symptoms, you really need to go ahead and get a test, because what we've seen many times through this pandemic is somebody is sick on Monday, little sick, they continue to go to work until Thursday when now they're a lot sick, and they get tested on Thursday and they're positive. Now all those people they exposed on Monday, Tuesday, and Wednesday need to be quarantined. If on Monday you were starting to feel bad before you went to work, you said, I'm not going to go to work today, I'm going to work from home or not work at all today, and got tested on Monday, then you would have avoided all those exposures. So that's the first thing. So testing is critical, because without testing, we're flying blind. Our first and highest priority should be readily available, accurate, and rapid testing. It should be as easy to get a test when you're symptomatic as it is to buy a lottery ticket. Well, there are about 20 places in Roseburg you can do this, and get a test. There's about 60 places to buy a lottery ticket, so we're not there yet. Once we've accomplished that, then the next set of testing should be high-risk areas, and the high-risk areas would be like nursing homes. We're already doing that, and the people around someone who is sick. So in other countries that have gotten this under control, what they've done is they found a sick person, and then they went and found the ring of people they were with, and then the ring of people they were with, and tested them all. So when South Korea had their outbreaks, they found that many of these outbreaks were tied to places of work, an answering center, a church, and then some bars, and they went in and they tested everybody at the bars. And it really worked and really brought their case rate down very, very quickly. So the turnaround time on the rapid tests is very quick. The turnaround time on the PCR tests varies. It goes between 2 and 4 days. I think we're at about 3.5 days now. So besides wearing our masks and washing our hands and staying home, is there anything we can do to help Douglas Public Health Network? Well, first is be kind. I tell you, I've seen a bit of unkindness today. I was at a store today, wearing my mask, and somebody came in and yelled and screamed at the poor person who was working there about that this was the greatest infringement that she's ever seen, and started shouting. The guy said, "Just please leave. Just leave." And they got into this terrible argument. So just help by being kind, and certainly people have, for the most part, been really, really kind. Been really kind about this. I think other ways to help. There are a lot of people in quarantine now, and those people who are in quarantine sometimes find it hard to ask for help, right? So they may need somebody to buy them groceries. They may need somebody to walk the dog or do something else. So if you know somebody's in quarantine, if you can be kind of say, "Ooh, that's such a bummer. Is there something I can do to help?" So over the time, I've known 2 of my coworkers who got exposed, not at work, but they got exposed other places, and then they had a quarantine for 2 weeks or so. And the deal is to help them out buying groceries or doing something else is great. So that's one of the ways you could help. If you know somebody who's in quarantine, help them out. So our numbers just keep getting worse. Shannon says people insist the virus is not real. What can we do about the non-maskers? I don't know what we can do about the non-maskers. I mean, we don't want to make scenes like in this store today. The good news is everybody doesn't have to be perfect to make this go away. And the stuff that we're talking about is not the person who wasn't wearing the mask in the store. Really, the big things we've seen have been these big dinners where people voluntarily take down their mask and talk and chat with each other. That's really where we're seeing a lot of spread. So really to become less socially close over the next bit. Certainly talk to people on the phone. I have a dear friend who's in medical school now, and she's great. And one of the things we always say is, well, let's have a gin and tonic. And so she's back from medical school now, and we would typically go out for gin and tonic, but we obviously wouldn't want to do that in a bar. So we did sort of a virtual gin and tonic. It was just great. We still talked and laughed and reminisced about medical school and whatever, but it was relatively low risk. So that's the deal. So really do that. I think on the non-maskers, what I've seen is that our masking behavior has really gotten a lot better. I kind of, when I go out, I look around and see how many people are wearing masks. And people are really getting better about it. I think people are starting to understand what goes on. I think for those non-maskers and those others, I think we might just ignore them for now. Jeffrey said, are there any risks from dental surgery? Well, the dentists are some of the most careful people out there. It's just their nature to be incredibly fastidious about stuff. So even before this came out, they did the best job on wearing masks and shields, and now they're wearing fitted N95 masks and shields. So the chance that they'll give you something, or you'll give something to them, is pretty low. Now, the one caveat I make in that is that dental surgery, you obviously can't wear a mask because you have your mouth open, and they frequently take a while, right? So it's not like getting a vaccine, which would take 2 minutes. The dental surgery could take 20 minutes or an hour even, and so there's some risk there, but I think if there's any place in the county that's super safe, it would be the OR and the dental offices. So I got our answer here on the turnaround. The turnaround time now is 4 or 5 days on the PCR test. That's a long time. And that's why we would not recommend those tests as the primary test for symptomatic people. Because in 4 or 5 days, it's already out a long time. So that's why for symptomatic people, we're recommending the rapid test. Now, if the rapid test is negative and you want to get a backup PCR, that's perfectly great. If you're pre-op for surgery or pre-travel, PCR is great. It is far and away the most accurate test. But if you're sick, probably one of the rapid antigen tests. So Bobby said, is there an estimate on when the vaccines will be available in Douglas County? Yes. So let me tell you that what happened this week was the CDC Committee on Immunization Practices met, and they came up with strategies for who should get the vaccine first and who shouldn't get the vaccine. The only people who shouldn't get the vaccine are kids, because it hasn't been tested, and pregnant women, because it hasn't been tested in pregnant women. But for everybody else, they can get the vaccine. And so the questions were, are there certain disqualifying conditions? We do not think so. We think the other disqualifying condition is if you've had COVID in the last 90 days. So if you've not had COVID in the last 90 days, if you're over 18 and not pregnant, then you're okay to get the vaccine. So ACIP looked at it this week. Next, on the 10th, the FDA is going to look at the Pfizer vaccine from what I have seen so far. But from what I've seen so far, I would expect rapid approval. What I would really like is for them to post the application. The application is long, 400 pages or so, but I'd go through the 400 pages and look to see. I'd really like to have that level of detail, but I know the FDA committee will do that and go through that. They're going to have hearings. I would think they're likely to approve it somewhere next week, and then it'll get shipped after that. I saw the delivery schedule for Oregon. It looks like we may get 3 deliveries over the month of over 100,000 doses, so that's great. We think the vaccine is going to arrive in Douglas County in 3 different ways. The first one is going to be the Pfizer vaccine, which is that super cold vaccine. So it is going to go to the state, and then it's going to go to selected hospitals around the state that have super cold freezers where they can keep this stuff safe and not let it melt. And so it's likely to go to hospitals first. The next groups are likely to go to nursing homes, and there's this federal nursing home consortium that's likely to do that, and then the rest of it is going to come to public health, and public health will be given it to people. So when you look at it, the first group are healthcare workers and people in nursing homes. That's very logical. They're really high risk. You have to keep the healthcare workers well to keep things going so they can be well enough to give you the vaccine. The second group is going to be essential workers, and the third group are going to be high risk, other high risk people over 65 and those with high-risk conditions. The goal will be to have 60 or 70% of the people in the county immune to COVID. The goal would be to have that done by summer. To get that done, that means that we need to get about 60 or 70% of the population immune, which means that we need, because there's 110 people in the county, we need to have between 65 and 75,000 people immune. To get that, since they're about 90% effective, we'll need to give vaccine to 70 to 80,000 people. Everybody needs 2 shots. So we're going to need 150,000 doses of vaccine delivered between now and the summertime. There's only about 175 business days between now and the summertime. So that means we're going to need to do about 1,000 vaccines per day between now and the summertime. So we're really good at giving vaccines here. We've had the best drive-through flu clinic ever. But in our best one, we did 200 a day. So we're going to have to really up that to 1,000 a day and 1,000 a day every day between now and the summertime. A couple of big problems. This is going to be really complicated because it's going to require 2 doses. And yet the second dose has to be with the same vaccine as the first. So now we get 3 or 4 or 5 different vaccines out there. And you got the Pfizer the first time, you have to get the Pfizer the second time. You can't get the Moderna or the AstraZeneca or any of the other ones. So that's going to be a bit complicated. And we don't think the cold chain storage is going to change. So that's going to be hard now, but it's even going to be harder in the summertime when it's really warm. But I think we're going to start getting some healthcare workers immunized in January. I think we're going to get some essential work healthcare workers in December and January. I think we're going to get essential workers starting in January going to February. I think we're going to get high-risk people in February and March. And then I think by April and May, we'll get everybody else. And so I'm very excited about this. This is our way out of the pandemic. Clearly, masking and distancing and whatever has not worked well enough in this country to get us out of this. I think this will get us out of this. So we're really, really excited. So Jennifer says, how are our rural areas doing in terms of case counts? Well, it turns out that it has little to, since these are gatherings, and gatherings happen both in rural and urban areas, they're doing about the same as everybody else, right? If they have a gathering in a rural area, they have a lot of cases. If they don't have a gathering in Roseburg, they don't have a lot of cases. So it seems really related to the behavior rather than to the closest. Now, early on in the pandemic, places like New York City had a lot, but New York City has a closeness like you don't, if you've not been in New York, you just don't recognize. So think of years ago when you had Black Friday and there were so many people in the stores and the malls and whatever else. It is like that every day in New York. And so you can imagine how many contacts you would have there. In Douglas County, the difference between the rural areas and the urban areas is not that great. We don't have a lot of mass transit. We don't have a lot of big gathering buildings and whatever. So rural areas are doing about the same as the urban areas. The problem in rural areas is they have a lot less resources. So if you have a lot of cases in Reedsport, they've got that tiny little hospital over there. They struggle a lot more than if you'd have it in Roseburg. So Jenna says, am I getting the vaccine? Absolutely. So as Dr. Fauci said, and the 3 ex-presidents said, as soon as we are eligible to get it, give it to me. And I would certainly go ahead and get the vaccine, and I would recommend it for those around me who I love, because I don't want to see any of them get sick. And if it has 90% protection, that is just fabulous. I mean, I would have been, if we'd had 50% effectiveness on these vaccines since they were developed so rapidly, I would have said that was great. 90% effectiveness is really quite a dream come true. Okay, a couple more interesting things we've seen along the way here. One is about mink. So we talked about this the last time. A mink farm in Oregon with the disease. And again, that shouldn't come as a great surprise because ferrets, which are really closely related to mink, have been a model for a human respiratory disease for years. And so we use ferrets to figure out how flu is going to spread so that similar respiratory disease would spread in mink is not the least bit surprising. Other good things about transmissibility in kids. We've been all over the place from kids transmit it to they don't, to they do, to they don't. And my sense along the way is that the studies are really hard to interpret. Turns out now that kids probably transmit like everybody else. Not more, but probably not a whole lot less. But they tend to get a whole lot less sick from this. So when we look at the cases in in the world and in the United States, we've certainly seen a lot of kid cases, but we've not really seen a lot of pediatric disease, bad pediatric disease. So that is the good news. And I spoke with the infectious disease doctor from OHSU the other day. Certainly, if there were bad people with bad kids who were really sick with this, they would know about it. He said, "Yeah, we really don't have any sick kids with this. A lot of sick adults, but no sick kids." So there's an OIG alert today about COVID fraud. Yeah. So an example of the fraud scam they're seeing are scammers contacting people unsolicited, saying they're doing contact tracing or trying to get someone's insurance information. Yeah. We do not know that we've had any scam attempts like this locally. However, it really, truly could be a big problem. So if there is an issue, there are a couple of things to do. One is we will, as contact tracers, we will never ask for your insurance information. We're not going to ask for your social security number. We're not going to ask for your bank account numbers. We don't need to know any of that, and no contact tracers ever will. We will, and I do some of these case investigations, we do want your name and date of birth so we know this and where you live so that we can figure out if you're geographically connected with another case. We might ask where you work because you might have exposures at work. We might ask where you go to church because you might have exposures at church. We might ask about your individual symptoms, but I'm not going to ask you about your insurance information or that. If you think this is a scam, hang up, call our hotline, 541-464-6550, and verify that it's really, really right. Because the last thing we need is for people to have their confidence in contact tracing undermined, right? If you think, oh, I'm not really sure I want to talk to this person, we're not going to get the information we need to keep this under control. So how will an individual with an underlying condition know when it's time to get the vaccine, Misty asks. I don't know, because I don't know which underlying conditions they're going to consider, and I don't know how they're going to separate these. There is going to be a big group meeting in January to go ahead and do this. That's going to be plenty of time, because there's not going to be the 1A and 1B. So 1A, the healthcare workers and nursing home personnel. 1B, essential workers, are going to take us till the 1st of March, I think. So that's okay. Yeah, so Aaliyah says, I hear that some countries have been treating this as a blood issue rather than a respiratory disease and having great results. Is this true? Could transfusions really be the best treatment? Well, sadly, transfusions haven't seemed to help very much. And that is disappointing, because it's disappointing, because we really thought that convalescent plasma would work. Now, this appears to be primarily first a lung disease. So the typical course for people who have mild disease is they have an upper respiratory illness and flu-like symptoms. We don't think this virus ever leaves and gets into the bloodstream. We think it's always in your respiratory mucosa, and your body's response, making cytokines, is what gives you fever and achiness and GI symptoms and whatever else. However, it has extreme problems in the blood system. So clotting is one of the biggest ones. And so clotting seems to be a really big problem with this. So people clot things off and they lose a leg or something like that. So that really is problematic. The other thing that we've seen is that people then also have bleeding with this and inflammation of the blood vessels. So it really is a weird disease with that. I think in the United States, we are really much more tuned now to the blood vessel issues here. So there's a lot more use of early anticoagulation. So we'll see. We've gotten so much better at treating this disease. Early on, of the number of people who were hospitalized, about 25% died. So early on, if you look in the March, April time, if you were hospitalized, 25% of the time you died. Now, a lower percentage of people get hospitalized, and only about 6% of the people who get hospitalized die. So the in-hospital care has really tremendously improved, partly because they're dealing more with the blood vessel issues, but also because I think we're delaying intubation a bit, and because they're letting people live with lower oxygen levels than they previously did before. So yeah, we're getting better on this. It hasn't gone down much below that 6 or 8%, but we're getting better on this, and this is the reason not to have said, oh, let it blow through the area, because if you just let it blow through in March and April, you presumably would still have, during that time, you would have had lots more deaths than waiting until now when we seem to be better at treating this. So Katie says, do we know if a vaccinated person can be a carrier? No. We do not think that the people who have been vaccinated have carried much of the disease, but the Pfizer vaccine and the Moderna vaccine looked at symptomatic infections. So they didn't, for example, do COVID screening on them every day, right? Because you could have done that, right? You could have given the vaccine, screen everybody for COVID every day to see if they have it and see if you had asymptomatic carriers. That would have been really complicated to do. Rather, what they did is they waited for people who had symptoms. When they had symptoms, either they got a test, and then if they were positive, then they found if they were in the treatment group or the placebo group. So we do not know if a vaccinated person can be a carrier, but less likely so. Again, this asymptomatic part of the disease is really problematic because most of the cases we've seen where they spread it on, the people who have given it to others have given it to the most people at a time they were asymptomatic. Now, later they developed symptoms, but during the time they spread it, they were asymptomatic. And that's what makes this virus extremely dastardly because, you go to Thanksgiving thinking you're well. Maybe you had a test a few days ago. You go to Thanksgiving thinking you're well. A few days later, you get sick, get tested, you're positive for COVID. You may expose all those people you were with. So that's why we need to be careful. So Nancy said, are the recent deaths related to one single outbreak? No. They are related to multiple outbreaks. So as I said, we've had church outbreaks, nursing home outbreaks, outbreaks related to travel. So travel is still a big one. Over this Thanksgiving holiday, we saw several related to out-of-state travel, and one of the deaths today was related to out-of-state travel. So careful about out-of-state travel, careful about gatherings. Someone says, will teachers be considered priority for the vaccine as essential workers? Yes, they will be. All right, that looks like it for the questions. Thank you all. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer from Douglas County. We'll do this again next Tuesday. If you have questions, please put them in at Facebook questions at douglaspublichealthnetwork.org. We'll collect those questions, and we'll do those first next Tuesday. In the meantime, a couple of things. One is be really careful out there, stay well. There is a lot of disease out there. So really try and avoid those gatherings, especially close gatherings, especially gatherings where you would take down your mask, and especially gatherings where you're going to be eating or laughing or doing the other kind of things. Because you're feeling well and the other person is looking well doesn't mean that one of you isn't brewing this. So be really, really careful with that. But don't avoid contact with others. Lots of time for Facebook, lots of time for Zoom. A Zoom gin and tonic was really delightful yesterday. And I had a new grandbaby yesterday that we got to meet on Skype or one of those things. It's just adorable to watch baby Elise. And so you can still stay close, you can still be in contact with people, but be really careful about being in close physical contact, especially when your mask is down. Again, this is Dr. Bob Dannenhoffer, Public Health Officer in Douglas County. Thanks.